Hello, my name is Steve Rodriguez. I'm a family practice doctor in Dallas, Texas, and I have the notorious face pain syndrome, also known as trigeminal neuralgia, tic-de-la-rue. It is a type of head pain. Anytime you have pain from here up, it's a head pain, headache, basically. So the basic complaint is I have pain in this part of the body. So a headache. A headache is any disturbance in the peace and quiet in this area of your body. Trigeminal neuralgia is a complicated, mind-boggling disease that is embedded in all the neuroelectrical systems of your head. And it feels like that sometimes. It can feel like that. Some people say it's like a feather or a string across the face, a web, a band, a kite. Mine is all of those. Plus, I have what I call the taser phase. And the taser phase is just like a taser. And this morning I was washing my face and I thought I had it under control, and it reminded me that I still had to work on it. So I was washing my face and then I got a tick. It's like, whoa. I think, okay, it's back. And then I kept washing my face, and then all of a sudden it let out a huge reminder, and this is what it felt like. And every time it go, you go, it is unbelievably uncomfortable. I can't even imagine people who have to live with that without knowing that there's an absolute treatment for it. It takes time and effort, but it's 100% treatable. I used to think that I could easily treat pain, lickety-split, half dozen to a dozen office visits, and then you apply the recipe of the protocol and the pain goes away. Not for trigeminal neuralgia. There are just so many overlapping structures, nerves, myofascial junctions in your face that it is impossible to figure out. The only thing you can do is treat it, and that's what I'm getting ready to do now. And I have about 5 triggers. One across here, one across here, one across here, and one across here. I think I have one deep inside the pterygoids also. You have to treat them all. How many times? As many times as you need to, as often as you need to. You have to treat it just like you would treat a deadly cancer or pneumonia or some type of infectious disease. You have to attack it, and this is the only tool to attack it with. All of the myofascial constructs of body pain below the neck kind of fit a particular pattern. Not in the face and neck. It is absolutely impossible to figure it out. But you can treat it, and this is the treatment. So I have one nasty one here that I'm always messing with. This is stage 5. Stage 5 myofascial pain. It's like your muscles going from filet mignon to beef jerky. Dry, stiff. Also, dry, stiff where the tissue transform into like the capacitor of an electric eel, and it'll send out a shock at the touch or shift in your mouth, or you're eating or brushing your teeth or blinking or touching your face. It's miserable, absolutely miserable, but it's treatable, and this is it. Ouch, that one hurts. I used to think if I could find a spot that was really painful, that was the perfect spot. There are no perfect spots. You have to stir all of this over and over again with your needles. The other part of this is that you can't stretch your face muscles like you can your lower back. It's almost impossible. And sometimes you can get a setup of pain in a muscle and stretch has no effect. So you have to use needles. And I'll put a post up here later. And then I'll come back and I'll show you what I've done. I can't see this very well. Let me do a few others. And that point right there is not going through. It's like it's on something and it just will not go through. Oh, there it goes. So when I do this on a patient, I'm much more humane. I also have laughing gas for people who can't tolerate it. They're just so beat up, worn down, that if you just walk in the room, they're shaking. And yes, it hurts. I've decided that if it doesn't hurt, you're not doing anything. And I can't really see. I usually have a reflective mirror up there, but I'm looking through the camera. And that's caught on something. Usually if I put it in, I can feel the bone as it hits the bone. But that one is landing on something that it's a muscle bundles that have turned into beef jerky. So the Greeks, the Romans, the Middle Easterners, Chinese, all use some type of needles. And because it's a perfect tool, it's the most perfect tool in medicine. It's basically a massage tool. You can reach in farther and massage the muscles. You have to stimulate the muscles back into health. And I'll work on that later. That's it for today.